So it's a pleasure to introduce Dr. Paul Lindell. Dr. Lindell is an assistant professor of radiology in the Department of Neuroradiology at Mayo Clinic in Rochester, and he's going to talk to us today about imaging in acute ischemic stroke and penumbral imaging. Dr. Lindell.
Thank you so much. I'd like to thank the organizers for once again inviting me, and it's a pleasure to speak to you. What I'd like to do today is to talk to you in a practical approach about imaging in stroke. In the past, I have had a considerable amount of CTA, MRA, MRI in this, but given the topic of penumbral imaging, I'm going to concentrate for the most part on CT right now. I have no disclosures. So what I'd like to do is start with a review of basic head CT and stroke, and this will be considerably more important as we move through the lecture and we get to penumbral imaging. I'll talk about CT perfusion in a more detailed fashion because as we approach penumbral imaging, having an idea of what these parameters actually mean will help us to identify problems that we have in processing and what you're actually seeing. Then we'll do some cases, and then we'll talk basic perfusion cases, and then we'll move into penumbral imaging and how that can affect your practice. So basic non-contrast head CT. It is the critical first test in stroke evaluation. We, yes, use it to exclude hemorrhage, but we also use it to evaluate for some early signs of ischemia, such as loss of gray-white differentiation, which is the earliest sign that we're really going to see hypodensity when the infarct is more profound. We can see regional sulcal effacement and swelling, which is another early sign prior to the hypodensity. And then we can also see hyperdense vessels occasionally, although this is somewhat problematic in the setting of calcified vessels and previous contrast, so on and so forth. So essentially, CT is a big densitometer, and the density between gray matter and white matter has several constituents. So we have cell bodies in the gray matter as opposed to more structural elements and cabling in the white matter. We have differential blood flow. Since we have more blood in the cortex and blood pool, blood volume, it leads to greater density. And then structural